When I first started, there wasn't much in the infection control. Nobody realized the implications of not having that infection control in place.
We never used to put up barriers, and they would be pounding away on the walls, and that's not good.
Many of the contractors really didn't realize how important it was. It was, yeah, we have to do this, you need to do this, but there was no understanding of, here's the basis for it.
On that other side of the wall, there may be a patient who just went through chemotherapy, or maybe there's a brand new baby in that bed. Now your construction site is right in an area where you have very immunocompromised people.
Any work that's getting done could have repercussions for the patient. Noise, dust, smell, all of those have a big impact.
I felt it was extremely important that my guys were always aware of doing their part to minimize any hazards to our customers' patients.
It's very important that these things are in place, and they are today.
It's helped not only the staff, but it's also helped the guys that are actually doing the work, so they go home safe at night too.
They realize that the care of the patient's #1 priority. It used to be, we're there to get the job done. Now it's, we're there to support them. Carpenters are really the forefront of this. They're leading the charge in infection control.
Healthcare providers more and more are going to seek out contractors whose employees have had high quality, standardized training.
Since the ICRA training, we have a better relationship with the infection control team, construction, and facilities team, and it's helped us understand what the standards of practice are and to update our process.
It provides a level of conformity for all of our folks and our procedures. So at some places, we're actually above and beyond what is required through the facility. Construction workers don't necessarily know hospital lingo or what questions to ask or what we might be exposed to. This closes the gap on the communication, and we can work better with the hospital staff.
In infection prevention, you don't get a lot of training, but you're expected to be an expert in construction and walk around the hospital and look at those risks for the patients. I've had contractors who will actually go above and beyond and teach me some things because we have that relationship already.
I think the most important thing about the ICRA class is making sure that you have a good mix of your maintenance individuals from your hospital, your general contractors, your subcontractors, and your infection preventionists. And it's amazing when you start sharing those areas of expertise, how you see things from different perspectives, and then you understand the why we do what we do.
The contractors are going through the same training as the facility is, so now we both have a common goal. They've done a lot better job of paying a lot closer attention to containment. The infection control people can go up and view the process, and that they're much more satisfied with what's happened.
We discuss it when we go pre-meet for a job, how we're going to take care of infection control, where the route's going to be, where we egress, noise levels, times we can work.
We meet weekly to talk about what is going on in the construction process, where we're at, what needs to be done by each person, and then we walk through looking through the construction process to make sure all the precautions are in place.
The course provides tools for interacting with the trades. We don't get such last-minute requests anymore, and it's a respect of everyone's time and making sure everything is done correctly.
The carpenters are doing a very important thing in training. They not only train their own rank and file, but they also train other trades.
We want to get the job done, and we want to do it in a way that keeps the patient and customers and families, anyone who's in the facility, safe. We have a better communication line that way because we all have the same common goal.